Okay. Good evening. I'm Lisa Deaton. I'm the current Secretary Treasurer for the Louisiana Nurses Political Action Committee. And tonight joining me, I have our chairman, Ms. Patricia LaBrosse, as well as candidate BeldenBatiste, who is running for a seat in Congress to represent Louisiana for the 2nd Congressional District. And
Yes.
we welcome you here tonight and look forward to you responding to our questions.
All right.
So, Mr. Batiste, if you want to open up and give us a little brief opening remarks, and then once you do that, I'll begin to ask the questions.
All right. Good evening. How you doing? My name is BeldenBatiste. I'm from New Orleans, Louisiana. I'm running for the 2nd Congressional District, which comprises of 10 parishes: St. John, St. James, Orleans, Jefferson, West Indies, Baton Rouge, Ivoryville, St. Charles, Assumption, and Ascension. The reason why I decided to run was because the leadership in Washington, D.C. has failed us. And I have a proven track record of being 36 years on the ground, a community activist and an advocate. I started out at 14 with a freedom rider by the name of Mr. Jerome Smith, who was one of the freedom riders and marched with Dr. King, and he had a program for youth. He made me the youth director. I was over 100 youth workers and 30 adults and 500 kids. So it was a pleasure for me to do that, and we can't keep doing the same old. And I'm about to close. I won't accept money from nobody nothing that harm the environment or nothing that harm the people. And so I just want y'all to know I'm a grassroots candidate, and I'm for the people, and I'm going to stand with the people and always fight for the people, fight for the nurses, fight for everyone. And that's it.
Okay, well, thank you. As you know, candidate Batiste, the Louisiana Nurses Political Action Committee is actually sponsoring this, the questionnaire that was submitted to you. But those
Yes, ma'am.
questions came from nurses across our state, and they were finalized by the Board of Trustees looking at what is called the social determinants of health, and
Yes, ma'am.
also the most popular issues that were submitted to us by our nurses across the state. So our
Yes.
first question is, currently gun violence is a public health issue as evidenced by CDC rankings. What is your position on providing appropriations to CDC to fully conduct gun violence research?
All right. I filled out the question. It was I gave some very long answers. And so what I believe that the work of the CDC is critical. And the gun violence, I'm tired of seeing senseless young people being killed across the country. So I think there's more the CDC can be doing. I think we should ban all assault rifles, all big guns, and make sure we have universal background checks. Also, I believe in making sure that they can't buy guns off the line, because what I discovered was from some young people that you can buy the guns and parts off the line, and that's how they are getting. So I think the CDC, I think they're doing a job, a well job, but I think there's more always for improvement.
Okay. Question number 2. Researchers agree that there is a direct relationship between poverty and health outcomes. This has been more pronounced during the COVID-19 pandemic. What initiatives would you use to address the effects of poverty on health outcomes and disparities?
All right. As the son of a single mother who have struggled. We have struggled from a long time. My mama raised 5 children. We struggled and we struggled real. And my mama really had the struggle. So what I'll do for the poor, the resources, community resources haven't been getting that. So I got a team. Well, this is my plan. I got a team of the 10 districts, because I include the 10 districts that I work with. I want to put all of them together so we can come up with solutions to deal with poverty and to deal with COVID-19. Because when in my district, just in my district alone, the 10 parishes, people have been hit by COVID hard. And I think that I take my hat off to the nurses, because the nurses was the frontline workers. They risked bringing COVID back home to their families. Their families could have died, and I always love to share this story. They had a 26-year-old nurse. I saw on CNN. She put a mask on her face, and she kept that mask on every day in equipment because they wouldn't give her safe equipment, and she died. So my thing is enough of the poverty and everything. Me as being an independent, I'm not a Republican, I'm not a Democrat. I'm an independent. I will hold them accountable. I will make sure that the funds that comes to the poor communities for poverty goes there, because that's where the money should be gone to solve poverty, but it's not going there. What they're doing is giving the money to their friends and their cronies and Big Earl and the big corporations and the tax breaks. But what I do, I'll make sure that we are dealing with poverty. I'll make sure I have a team to discuss poverty, even though I know it might be something, the team know, but we will fight every day of my life to make poverty better for the people. Now, I think we should cut the national defense fund, and I think we should tax the rich, and I think that money, we should do the right thing with poverty and use the money and make sure we're addressing poverty and holding them accountable when they get the money. Because what have been happening, they have been getting the money and we don't see a change with the poverty. We don't see a change with nothing. And where I'm really disappointed in the United States with the Republicans, the Democrat, and the president, this is my thing. I was really hurt to see that they gave nurses $250. That is a disgrace. That is an insult, because the nurses have fought. It should have been a 30,000 to 50,000 bonus. Now, I'm not saying that's what I'm saying, but it should have been better than 250, because nurses struggle with poverty. Nurses struggle to pay their bills, and we got to do better. Then I think every nurse that got a student debt loan should be canceled, because the job they did for COVID-19 was an A1 job, and not just COVID-19. The nurses have been doing the job, because they go every day before COVID-19 to put their self on the line. Listen, I died on the table 2 times from a cold blue. And if it wasn't for good nurses nursing me back, I wouldn't be here. So I will fight hard, make sure I'm addressing poverty, but I want a nurse fund. And what I want to do for the 2nd congressional district, but just not for the 2nd congressional district, I want to go to the Washington DC and draft a bill where the nurses have a pot of money to draw from, because you got a lot of nurses living in poverty. You got a lot of nurses struggling. So that's what I would do.
Okay. Question number 3. The Affordable Care Act has made health care available to millions, including per diem RNs. Do you support the continuation and improvement of the Affordable Care Act? If not, how would you ensure all Americans will have access to health care?
All right. I would support the Affordable Care Act, right? But I would push for this. How I will assure that all people have health care, university health care for all, such as um, Medicare for all. I mean, Medicare for all. That's how I will address it, because I think by us being the United States of America and we say we rich, well, let's show it. Let's show it like other countries do. You got countries, they don't even pay medical bills. They don't pay none of that. So my thing is, I'm with the Affordable Act, but I want to go farther than the Affordable Act and making sure that they never it. You know, when another president come in, try to get rid of it or nothing. So I'll fight on Washington, D.C. I'll support the Affordable Act, and I'll be pushing for university health care and Medicare for all.
Okay. Question 4. We are all aware of the rising cost of medications, which often have citizens making choices to feed their families or buy their medications. Oftentimes, when working people are retiring and are on a fixed income, such as Social Security, the cost of medication skyrockets. What are your plans to reduce and control the cost of medications?
All right. My plans are simple. I will stop the medical companies from raising the price on the medicine, because some of the prices are outrageous. But to bring it down for people that's on Social Security and retired, and just not on Social Security, because you got some people on welfare or whatever they might be getting, I think the medicine should be a part of the United States to pay for all the people medicine, because there's a senior I know, she's 78 years old, and she got to pay high lights, a high water bill, a high a high tax on a house, right? And then she got to pay this Cox cable bill and all other bills. But guess what? She only get 9 something a month, and she go without her medicine. So what I do, I make sure I can pay that cost. Even though it's $6 and $7, I pay every month to make sure, so I know what it is. But if you on Social Security or you on any government assistance program, and just not that, if you getting retirement, the medicine should not go skyrocket. But why it's going sky high? Because all the politicians, Republicans and Democrats, and the president are taking these pharmaceutical companies' money. They give them campaign endorsing, so they don't care how high the medicine go. But what I'm saying, BeldenBatiste, who's running for Congress, I'm going to hold them accountable. And I might, you got like 300 and something people that vote, but I'm going to be that one that scream, shout, and everything, because people do not deserve to pay these high costs on medicine. Even me, my medicine be high. And I take like 30 bottles of medicine because I got blood clot health issues. But guess what? I wanna go to Washington and try to draft bills that we can bill the citizens of the United States out if they having medical, with the pharmaceuticals being so high. I want to bail them out. Now, they do extra care on Medicaid, I think, Medicaid or whatever, but that ain't enough. We gotta come with a bill where it will be very, very low. And if it's a copay, it should be $1, but I don't think it should be a copay because people are struggling every day living in poverty, and it's hard. And COVID-19 has struck everyone. People are losing their jobs every day, and people are sick. We got mental illness going on. We got COVID-19. We got cancer. We got sugar diabetes. We got all kind of issues. And the United States of America should make sure that their citizens' health is number one. And so I'll hold them accountable. I'm not going to take no money from the pharmaceutical companies or no kind of medical companies or nothing, because I'll be the best advocate to fight for the people. And another thing is I want to address, I don't know if y'all, I want to put this in, and it might not be related to the question, but women's rights. Women's rights. I will fight hard, because when a woman got to make that choice of abortion or not, I'm a man. Men should not be drafting bills for women that's trying to have babies and they got to have abortion because they have issues. A woman know what her body can do. I'm not saying, abortion is one, but they got a lot of issues. So I want to address that. I want to support those women, making sure they have rights that's going to protect them, and not with Republicans and Democrats that's trying to decide for the woman body.
Okay. Question number 5. Registered nurses are ranked as the most trusted profession in the Gallup poll. As the largest segment of healthcare workforce, the 2010 Institute of Medicine report recommended they lead the transformation of healthcare in collaboration with other healthcare professionals and policymakers. How could you assist with getting qualified nurses on national boards, commissions, task force, as well as appointing RNs to your staff if elected?
Well, the first thing is I got a nurse on my staff. I got a group of nurses that address me on health issues, because I know about the health issues, but nobody knows better than the nurses. And I would draft a bill to try to, you got to draft the bill, draft the policies, but I will fight to get RN and nurses on there, because they know what best for us help for the people. Now the doctors know, but nobody knows like the nurses, because they deal with people every day. And I think with this COVID-19, it should have been just what you said: RNs, doctors, and nurses, but mostly the RNs and the nurses. I will fight every day of my life. I will love to work with nurses. And if I'm elected, the group that y'all support, I would love for y'all to be on, join my team, keep me advised, let me know what's going on, and I will fight it y'all with, because y'all know best. Y'all deal with everybody, sick people, the shot, people that get shot, people that's going through, stage 5 cancer and all this. Y'all see all that. So why can't the United States of America be smart and deal with groups like y'all group, other nurses group, RNs, and bring them aboard, but have a stipend. See, I just don't believe in bringing y'all aboard and taking y'all advice and not getting paid for it, because in Washington, D.C., they bring lobbyists, they bring all these people and they pay. So if we bringing y'all on board, I want to draft a bill where nurses join the board and they get paid for the advice and their service.
Okay.
And with that, one thing I can tell you, I'm not your everyday politician. No, I'm the people's candidate. I'm a champion for the people, such as the nurses, such as the other people. And I won't lie to you. I'll never lie on you. I'll never lie about you. But look, I'll fight for you, and you can hold me accountable, because I'm a grassroots candidate. And it ain't about who got the big campaign signs, ain't about who got the most money. It's about who got the heart for the people, and nurses and frontline workers and everybody that then help during this COVID-19. Because I think that the United States have disrespected the nurses and all the frontline workers, because if it wasn't for them, COVID-19, people have died, and lots. But if it wasn't for y'all, it'll probably be 10 to 15, 20 million, because y'all do it. And I met an old lady She was 90 something. She caught the corona. And they had a nurse from University Hospital. The lady was sick, no family or nothing. Do you know what that nurse did? After she got off her job, she went there every day, cooked for, nursed her, and everything. So when nurses do that, that's what makes the nurses matter. Nurses matter. Nurses matter. And I will do everything in my power to fight for the nurses every day.
Okay. Well, we appreciate that, and thank you for your responses to the 5 questions. And now we would like to give you 1 to 2 minutes to just give us your closing remarks.
All right. First of all, I want to thank y'all group. It was a pleasure for me to talk to y'all, to speak to y'all. So thank y'all, and I'm glad y'all do these forums. I mean, I'm glad that y'all do this because as nurses, y'all showing that y'all care, and y'all showing that y'all care about y'all patients, about y'all, and y'all showing that y'all will hold us accountable. Now, my name is BeldenBatiste, Noonan Man. Belden Noonan Man Batiste. My daddy gave me that name. I'm on the ballot November the 3rd, 2020, number 19 for the 2nd Congressional District. I'm asking everyone to vote, and I'm asking everyone to go out and early vote October the 16th and the 27th, but just don't vote for me. We got a president election, and it matters. Your life depends on it. Nurses' lives depend on it. Everybody's lives depend on it. And we need more grassroots people. I thank all y'all. I pray for y'all. I pray for all the nurses. I pray for everyone as a frontline worker. I pray for the people with COVID-19, the people that's sick. And I will be your next councilman. And I hope I hear from y'all, and make sure y'all hold me accountable. And if I don't do it, you pitch a brick at me. Thank all y'all.
Okay, thank you.